The highlight of my GP placement is meeting patient. We are giving an opportunity to interview patient to understand their experience of illness from a patient point of view and how to apply that in clinical practice. Our GP placement starts in first year, like about maybe 6 weeks from starting from October onwards with a Christmas break, and then starts again in January until May.
Placement is a little bit different for everyone, so we go every other Wednesday for a full day, but some of my peers go every week for a half day. Placements are assigned by the programme team, who will try and allocate you a placement as close to home as possible without being in your own GP practice. This isn't always possible, and you may have to travel a short distance, but if this is the case, then there is reimbursement options.
Generally, what we do in placement are tutorials and sit-ins. So, for example, in the morning we will do GP tutorials, and then in the afternoon we will do sit-ins, and that includes patient consultation in the practice or home visits.
So in first year, there's no expectations of what you should be capable of doing. It mostly is observational. However, I've had the opportunity to do things such as breast exams or baby hip checks, and you're always encouraged to ask questions and try and be as involved as possible.
We are continually being assessed throughout our GP placement, and that would include professionalism, including your attendance, being honest and being open, and with confidentiality. There are certain components of the GP placements that are directly related to other modules of the course, such as SIM, like the social and ethical aspects of medicine. You will be doing patient interview, as well as you will be doing a presentation about public health, so that has direct, you can directly get that from your GP placement.
Balancing is difficult, so I'm a mum of 3 as well as working part-time, so I feel keeping a diary, our placement's really good at sending us what's going to happen that semester. So we have all our dates in advance and we know what we're going to be talking about on those lecture days. One of the highlights for me was being involved in the baby clinic. So we got to go in and see new mums that are 6 weeks postpartum and do baby health checks, so that was really nice to see. And every GP placement has different specialties as well. So something I'm hoping to get lined up is to get involved with a minor surgery specialist in the practice.